So today, Dr. Jayawardane will deliver the keynote address on the topic of importance of Rasaushadhi in successful Ayurveda practice in Sri Lanka. Over to you, Professor.
Nice to see you all my students and colleagues. Thank you very much, first of all, with my immense honors and privilege on this prestigious gathering here. I have been given the topic, the importance of Rasaushadhi in successful Ayurveda practice in Sri Lanka. The term Rasashastra is composed of word Rasa and Shastra. As you know, in general word, the Rasa represents many things. That is Swarasa, juice, taste, Divata Dhanana Rasa, and the essence, the Rasa. Apart from that, there are so many rasas described in many texts. One is Nava-Nalu Rasa. It is given by Natya Shastra Bharata Muni, starting with Srungara Rasa. Everybody now experience the Srungara Rasa here now. And there are so many rasas in Navarasa: Hasya Rasa, Karuna Rasa, Raudra Rasa, Veera Rasa, Vibhatsya, Adbhuta and Shanta Rasa. In yoga text, there are three rasas has been mentioned, especially Srungara Rasa and Veera Rasa and the Shanta Rasa. If you practice the asana and pranayama, you can experience these rasas, then you can practice easily. Another rasa is, I would like to say, Dhootapapeshwar. And you know that in Sri Lanka there is another rasa, what is called Menna Rasa, Mayai Rasa. What is that? Sirasa. So, we will go through in this context. As far as the Rasashastra is concerned, we use the two meanings. One is the absorbable form of drugs. It is very much easy to absorb through the gut. And the second one is mercury, rasati, bhaksheti, sarvan lohan iti rasaha. Ayurveda, the system of Ayurveda describes the science of Rasaushadhis for the sake of quantitative and qualitative health. Not only that, we can improve our lifespans. Rasa Chikitsa in Ayurveda evolved to overcome the shortcoming of Ayurvedic treatment, such as sometimes the patients complain as it is very much difficult to swallow because of unpleasant taste. Sometimes we give 30 ml kasaya, TDS. Some complain that it is the large doses, it can't drink it. And we have the medicine which have short lifespan and delayed effect. So if we get the delayed effect, our patient not satisfied. Many rasa preparations clinically have been proven to be successful in treating the various disorders with minimal side effects, adverse effect. The mineral and metals are very effective and potent for immunization, rejuvenation and the eliminations of disease. Rasaushadhi, the drugs rasa, are very safe in therapeutic doses and absorbed easily in the body. As we compare to conventional medicine, Bhasmas, etc., are the unique rasa preparation for curing the disease, can easily enter into the bloodstream and become more biocompatible. The Rasaushadhi have developed a new era in nanomedicine. It is very much important aspects, the nanomedicine, due to their nanoparticle size. And the holistic approach, Ayurved is one of the holistic approach systems of medicine. And towards the diseases, the nanoparticles were different from the original particles in structure and chemical positions. It not only increases the surface area, but the nano size also helps the drug to reach the target site of efficacy. The indication, dose, mode of administration, duration of treatment, nature or prakriti of the patient, and the pathya, etc. are the important factors that should always be considered before prescribing rasa medicine to the patients. So it is very much important point that before prescribing the Rasaushadhi, you have to be considered many things mentioned in Ayurveda. If you go through the Charaka Sutra 1 to 4 and 1 to 5 sloka, Yata Visham, Yata Shastram, Yata Agni, Ashanir Tataushadam Vinyatam Avinyatam Vinyatam Amurtam. තේරුම කියන්නද? සිංහලෙන් කිව්වොත් ඖෂධය ගැන හරි හැටි නොදැන අවිඥාතම්. ඒ ඖෂධ ප්‍රෙස්ක්‍රයිබ් කරොත් එය මොකද්ද වෙන්නේ? විෂ වෙනවා. ඒ වගේම ශාස්ත්‍රයක් වෙන්නේ. ඒ වගේම අග්නි වගේ, ඒ වගේම විදුලියක් වගේ තණ්ඩ. ඒක නිසා සියලු දෙනාම දූතපපේශ්වරලගේ මේ ප්‍රොඩක්ෂන් ගත්තහපුවාම කියවන්න, ප්‍රෙස්ක්‍රයිබ් කරන්න ඉස්සෙල්ලා කියවන්න, ආයෙත් කියවන්න. පොත් තියෙනවා දූතපපේශ්වරලගේ print කරපුවා. ඒක ආයෙත් කියවන්න, ප්‍රෙස්ක්‍රයිබ් කරන්න ඉස්සෙල්ලා තුන් පාරක් කියවන්න. මදි. ආයෙත් කියවන්න. එතකොට විඤ්ඤාතං ඒ රග් එක ගැන හොඳ අවබෝධයක් ලැබෙවි. ඒ විට ප්‍රෙස්ක්‍රයිබ් කරන්නට පුළුවන්. අනිත් ශ්ලෝකය 124 සූත්‍ර ස්ථාන චරක අද ගෙදර ගිහිල්ලා කියවන්න. මම එකක් කිව්වා. හරි වැදගත් ශ්ලෝකයක්. මේ especially if you prescribe the Rasaushadhi for the patients. Rasaushadhis are the herbo-mineral or metal or mineral formulations. Rasa preparation also contain, you have to think about, it contain heavy metals like mercury, tin, arsenic and lead. Important factors, if you consider related to the Rasaushadhi administrations, you have to consider the proper dose and the time. It is very much important. Pramane, evagema kale. Kale is a dravya. Dravyak nam, dravyaknam yatra sita karmaguna karna samavayi yat tad dravyam. ඒක නිසා time factor, it is very much important, especially if you prescribe the Rasaushadhi. And mode of drug administrations, diet, pathya, routine management, self-life, testing and analysis of drug before use. These are the most important factors if you are going to be a Rasa Vaidyas. In my nearly about 40 years of this practice, I have become a Rasa Vaidya, and on the head table our Dr. Dayani is there. We have learned about Rasaushadhi much more when I was a student. So problem of the rasa preparations, the risks related to the toxic effect of Rasaushadhis can be considerably reduced by use by following good collections process, that is GCP, and good manufacturing practices and good laboratory practices for quality control and quality assurance for good quality processed medications and the various guidelines mentioned in Ayurveda classics related to the administration of drug. I have seen my naked eye when I was in India. I had a chance many times to visit Dhootapapeshwar company, and they are 100% following this important things. If you consider the problem in rasa preparation, all the rasa materials have purification procedure. That is very much important. That everybody asks that you are dealing with rasadiya and gendagam. මේව දෙන්න පුළුවන්ද විෂයද කියලා බයෝකෙමිස්ට්‍රි කරන අය විශේෂයෙන් ඕක අහනවා. ඒක නිසාද මේ purification procedure is very much important to prepare the drug. Unpurified or the poorly prepared rasa preparation can be highly toxic. Keep in mind that it is highly toxic and endanger the life of the patients. You have to keep in mind this. Preparation of rasa medicine is slow, very slow, and very hard. Isn't it, Ketan? Yes, very hard. And other problem is global non-availability. Globally, it is not available, Rasa Aushadhi, and globally, it is not acceptance, especially in the West countries. Advantages, if you consider the advantages of Rasaushadhis, it is we can use in minimum doses, minute doses, and easily the Rasaushadhis are palatable. And other one is it is fast acting. So if we compare the Ayurveda other drugs, the Kasaya, Kalka, etc., it takes long time to get the results. But considering that, if you prescribe the Rasaushadhi, it has a fast acting effect. Incinerated mineral process, excellent therapeutic values. And Rasaushadhi has longer shelf life. You can keep in counter for a long time if you don't have the patience. And preservation is easy. The administration of rasa preparation in the body is much faster. Why? The preparation undergoes different processes called sanskar. This sanskar helps in the active and quick assimilations of even the minute doses in the body. If you prescribe the minute doses, it has a quick assimilations. And other one is the efficacy of rasa medicine increases with time. Use of Rasaushadhis in independent form. Dosha, Dushya, Desha, Kala or Rogi Pariksha. Dr. Professor Kumudu, if you prescribe the Rasaushadhi, we normally teach to the student you have to consider the dosha and dushya and desha, kala and rogi pariksha. You don't need if you prescribe these things. That is the much important point. This is why it can be used time of urgency, emergency management. There are so many rasa preparation available in the market, even in Sri Lanka, easily available, but the price is comparatively high. In future, we will look to reduce the prices in near future. There are so many rasa preparation available in market which is useful in diabetes. You can use the diabetes. There are so many rasa preparations available in Sri Lanka. And liver diseases, anemia, obesity, heart diseases, skin diseases, or respiratory tract disorders, especially chronic obstructive lung fibrosis, very effective. And I would like to say, my wife is gynecological field. It is good for gynecological diseases, even cancer, not curing the cancer, but we can improve the quality of life. Rasaushadhis improves the immune system. That's why we can prescribe for the cancer patient to improve the quality of life. And helps to attain longevity. So sometimes I used to take Rasaushadhi, especially Choorna, especially Guti-Vati. So you try out this kind of thing which can improve the health and longevity and sharpness of sense organs and the rasayana therapy. You can see me, I am 66 years old. I used to take some rasayana therapy, so you can become a healthy තරුණ වෙන්න හොඳ මේකක්. ඒ වගේම බියුටි එක ආරක්ෂා කරගන්නටත් රස ඖෂධ තියෙනවා. දැන් දූතපපේශ්වරලගේ වැඩිපුරම ඒ බෙහෙත් අද ඉඳලා විකිනෙනවා වැඩි වෙයි මේ අය ගනි. So there are example for that. I don't take much time. There are approximately 430 rasa preparation that supports physician to pacify jura. 342 rasa preparation that support physician in pacifies kasa. Then kasa කිව්වට ආදරයයි කැස්සයි හංගන්න බෑනේ. ඒක නිසා මේක කැස්සට විතරයි ආදරයට නෙවෙයි. Right. And 283 rasa preparation that support physician to pacify the swasa. 9 rasa preparation that support physician in pacifies diabetes. 87 support to pacify rheumatoid arthritis. Due to the use of Rasha being the most efficacious drug in Ayurveda, no doubt that Rasavaidyas are supposed to be superior to their professional counterpart using surgical procedures and plant drug for treating the disease. In my practice, my drug counter mostly filled with Rasaushadhi, and my prescription also more than 50% filled with Rasaushadhi, the quality, safety, efficacy preparation that we manufactured by Dhootapapeshwar. I have been practicing this medicine with the Dhootapapeshwar Rasaushadhi since 30 years back. Therefore, I would like to thank Dhootapapeshwar for giving me the great opportunity to speak to you. Thank you. Thank you.
Thank you, Professor. And we invite you to come back to the stage as we have some special felicitation for you. A token of appreciation, a memento presented to you by Dr. Dangani Sinasekara, who is the chair of today's forum. Please accept this token of appreciation on behalf of Sri Dhootapapeshwar Limited.